Bismillahirrahmanirrahim. I'm Muhammad Sajid Islam Sharkar again in front of you to discuss about some important topics regarding symptoms. Uh, Symptoms of general fever, symptoms of cough and sneezing, for general flu. So, how will we understand about the COVID-19 symptoms? Because symptoms of COVID-19 and symptoms of general flu is more or less similar. So we will have to be very serious. We will have to be very attentive to understand the COVID-19 symptoms and what are the main or common symptoms of COVID-19 and what are the other symptoms rather than the COVID-19. So I will try to find out the answers of these questions, and I will try to say about some medication, symptomatic medication. Those who are saying by some of our doctors that since there is no vaccines, there is no medicine, so there must have some symptomatic medications that we are taking in case of general flu, in case of general cold. I will try to discuss. Sorry, I will try to discuss on some medications. Viewers' patients are required to understand. One more thing before going to start, some viewers have made some request and showed their opinions to make some videos in Bangla. In that case, I have given them the word that I will try my best to prepare some videos in Bangla. But matter is the topic that I am discussing in my video. If you pay your attention, you will find that there are some critical topic. There are some integrated. There are some complex topic that I am trying to open in front of you, want to discuss in front of you. So the people who are able to understand those complex terms and terminology, they are, I think, able to understand this easy English this English video. And if I want to make this video in Bangla, okay, fine, it will be very easy to understand for that class. But by keeping in mind that I am going to make this video in Bangla for the general people, but if I make this in Bangla, general people will not understand these terms and terminology. It will be very difficult for them. And this video is not for the general people. It's for the elite class. It is for a level of people. Otherwise, these terms and terminology will not be easy for them, even though I uttered this in Bangla or in English. So this video for a class, those who are elite, those who will understand some integrated course. They also know this. I'm not saying that they don't know, that elite class don't know the symptoms, or that elite class don't know the matters that I am saying through this video. They know this, but if you pay your attention, you will find some critical matters, critical integrated matters that I am trying to find out. I am trying to say in front of you for our better perception. So this is all about today's video. So I'm going to find out the answers of some questions that I have uttered in front of you at the earliest stage of this video. That is, what are the common symptoms? Before going to say this, through different channels, through different media, even WHO, Center for Disease Control and Prevention, and National Health Services, they are saying the symptoms of COVID-19 are not fixed. COVID-19 are showing different symptoms time to time, and since it's a new coronavirus, I mean novel coronavirus, so it has already 300 times new mutations. Through mutations, they have new 100 different strains they have already produced within this 3.5 months. So their symptoms are also changing, their symptoms are also changeable, and there are still a lot, there is still a lot about the symptoms of coronavirus that we don't know. And I think day will come, we will find some another new symptoms in case of COVID-19. So these are not fixed, these are not confined, that these are the confined fixed or confined or fixed symptoms of coronavirus disease. So day by day it will be changed, day by day it is changing, it is changing. So and these symptoms, even in case of same strains, they will produce different symptoms in different persons, depending on their immune system. If you have a very powerful immune system, you will have a very less symptoms. If you have a very weak immune system, you will have a lot of symptoms due to COVID-19. So it varied person to person. So rather than there are some common symptoms and distinctive symptoms. For example, we know, we all know, I acknowledge this, I admit this, that we all know this, though I feel courage to say about this for you, for our better understanding. The common and distinctive symptoms of COVID-19, is a cough. First is cough, along with some sneezing and fever, and third one is shortness of breath. Shortness of breath. This is the distinctive, especially character to identify the COVID-19. But in case of general flu, in case of general cold, we will not suffer from shortness of breath. I mean the trouble breathing and difficult to breathe. So why will it be occurred? Because if you have seen my first video where I have mentioned that why do we suffer from shortness of breath, or why it will be very trouble to take breath or difficult to take breath, because we know when COVID-19 attack, I mean coronavirus attack on our lung cell, I mean in case of alveoli, so they will kill epithelium of the cell, and they will kill basement membrane, and they will rupture the subepithelial tissue of the alveoli, and due to that, these alveoli or air sac that will try to exchange oxygen, that will try to take oxygen from the air, is becoming very hard. This alveoli, this air sac is becoming very hard, and in some cases it will fulfilled by water, or to some extent it will be fulfilled by some pus cells. So it will become hard, it will become stick. So due to this hardness, it's very difficult to take a breath, it's very difficult to have a breath, and this is called the shortness of breath for COVID-19 patients. So rather than these three distinctive symptoms, one more thing, during the hardening, in that cage there might have some inflammation within the alveoli, within the lung cell, and inflammation, we know, it's a medical term, it means it will be swelled up, it will be swelling, and it will be reddish in color. So due to these causes, hardening, swelling, will have some pain due to inflammation, and for that reasons we will have a very short breath. So this is all about these three main distinctive characters. Rather than these, we know there are some other important symptoms. It depends, that I mentioned earlier, that it depends on the immune system of the infected person. If you have a very strong immune system, you will suffer from less symptoms, and if you have a moderate immune system, you will have moderate symptoms. If you have a less immune power, then you will have a lot of symptoms. So including all those, the other symptoms are, for example, the patients will suffer from malaise. Malaise means it's a general feeling of uncomfort, it's a general feeling of uneasiness, and it's a general feeling of illness. Rather than this malaise, there might have some vomiting tendency. Even in case of severity of the disease, there will have some vomiting, malaise, vomiting. Uh, the patient will suffer from confusion. He will not be able to take a decision, final decision. He will be in confusion due to this COVID-19 disease. He will suffer from sweating. He will suffer from loss of appetite. That means he will not feel to take. He will not willingness to take a food or any other beverage or any other fluids. Rather than this, after 3 to 4 days, there will have some throat pain due to the attack of coronavirus. And also they might have nasal congestion, I mean a runny nose. That means some discharges will be from the nose. And nowadays we are hearing that they will have loss of smell, loss of smell and taste. They will not get any smell, either odorous or either fragrant or refreshing smell, and he will not get taste from the food and beverage. It's also a symptoms. They may have some broken voice during the severity of the disease. So broken voice is also a symptoms. Other than this, some patients will suffer from headache, and a research shows that 8% patient will suffer from headache due to new coronavirus attack, and they may have some chilling feeling. Some patients will feel chills, and research shows that 11% patient are suffering from chills due to the attack of new coronavirus. And other than those symptoms, some patients will suffer from muscle ache, and research shows that 14% patient will suffer from muscle ache due to the attack of novel coronavirus. Other than this, some most important symptoms regarding digestive symptoms. Some digestive issues will also be observed within the COVID-19 patients. For example, patients will suffer from nausea, patients will suffer from diarrhea, and research shows that it is published through WHO. This study was done in China and published by WHO, that 5% patient, 5% COVID-19 patient will suffer from nausea, and 3% COVID-19 patient will suffer from diarrhea. It is observed in China and published by WHO. So other than these, there might have some pain within the COVID-19 patients. COVID-19 patient will suffer from some pain. For example, pain, headache is also a pain, but muscle ache is also a pain. Other than these two pains, some pain, for example, joint pain will be observed in some patients, and some patients will suffer from pain in the finger, either in the hand or in feet, and some patients will suffer from back pain, and in severe case, some cardiologists are saying due to the attack of novel coronavirus, some patients will suffer from chest pain. And this is logical, very logical, because chest pain will occur because we know that heart is pumping to supply blood towards the all organs and towards all peripheral region even brain, even to the brain. Uh, so it will supply oxygen, and side by side there are some blood circulation within the heart. It will supply blood to all body, okay fine, through artery, and there are some artery within the heart also, that they will have some own circulation within the muscle of the heart. So if they have a low oxygen, if they have a less oxygen, minimum oxygen within the blood, due to the lack supply of oxygen from the lungs, because oxygen are absorbing from the air through air sac or alveoli from the lungs, and this oxygen will be added within the blood stream, within blood, and these will ultimately go to the heart, and it will pump to the peripheral region on brain, and also brain, and within its own muscle also. So if there have no oxygen, we will feel illness, weakness, sickness side by side. Heart, due to lack of oxygen within its own muscle, they will also suffer from pain. That is called ischemia. It's a cardiac related terms. So ischemia, I mean chest pain. There might have some chest pain within the COVID-19 patients. So really very panic situation, really very typical situation and integrated situation. So if I say all those things in Bangla, I think the people who will heard this in Bangla, okay, for we people, we class people, we will understand more better than English. But we are saying to have or to make this video in Bangla for the general people. But general people, actually, if we say even in Bangla, they will not understand these terms and terminology, and they will not bother for this. And this is not for the general people also. So I think this is very easy English, very easy English. So I think you will, if you pay your attention. If you pay your attention, I'm saying that if you give importance to this video, I think it will be easy to understand. So this is all about the symptoms of the COVID-19 patients. So now some medications that I have uttered, that I have said at the earliest stage of this video. For example, in case of fever, what will you do? I'm not a doctor, okay, but I'm saying because due to simple fever, due to catch cold, or due to the attack of general flu, we are not going to the doctor. And okay fine, at the first time we had gone to the doctor, and for repeated attack, we are not going to the doctor. But and we also know the medications, we all maximum know the medications, and doctors are saying that you can take symptomatic medicines. It's a very easy medicine. For example, fever, we can easily take paracetamol, or in the developed countries, some doctors are prescribing Tylenol for fever. So antipyretic drug we can take for fever. It's a suggestion for the from the doctors. And one more thing, a very important thing. Certainly, since it's a new disease, since it's a new symptoms, so those symptoms are old, but it's a new disease. We are very confusing about the symptoms and about the attack of this COVID-19. So you can talk to the doctors. How will you, or how will we take some symptomatic drugs for fever? Okay, fine. But this is my opinion. And doctors are saying like this, that antipyretic drug you can take for the treatment of fever. In case of pain, you can take some analgesics. You can take some analgesic drug, for example, ibuprofen, aspirin. These are the common prescribed drug, and doctors will suggest you to take this type of medicines. Okay, fine. And even you can talk to the doctor. For inflammation, anti-inflammatory drug you can take. NSAIDs you can take as an anti-inflammatory drugs. And for itching and nasal congestion, what will we take? We will take antihistamine drug. Antihistamine drug, it will relieve us from itching and nasal congestion. And And one more thing that I didn't mention, due to quarantine, and due to pandemic, and due to social distancing, since you are now in the home, I mean, since we are now at home, so and we are in home quarantine, and it's a very pandemic, because we are hearing a lot of news, a lot of worse news, a lot of sad news, that we are losing a lot of valuable lives, thousands to thousands throughout the world. So, due to this pandemic, due to this quarantine, due to this social distancing, someone are saying physical distancing. Anyway, we are not gossiping. We are not talking each other in front. So due to this, we might have some anxiety and depression. There might have some stress. There might have some fatigue situation. We also suffer from exertion and disorientation. So, for the treatment of this anxiety and depression, for the stress condition, for the fatigue condition, disorientation and exertion, because we will feel tired, we will feel discomfort, we will feel uneasiness. So, for the treatment of anxiety and depression, we can take anxiolytic and antidepressant drug, mostly prescribed drug in our country. Okay, no need to follow my medication pattern. Better to talk to the doctor. But doctors are saying that saying to take some symptomatic drugs by own, and they are saying to have some self management by taking this symptomatic drug, and they are saying to stay home and trying to have a self management. So we can easily take this symptomatic drugs and for this for the relief of this symptomatic symptoms. So anyway, the no today, more when we meet. If the video is going longer, viewers will be lower. So no more today. And one more thing, due to this pandemic, due to self quarantine, home quarantine, room quarantine, due to lockdown, whatever you say, and due to the social distancing, we are actually now in stress. We are actually now in anxiety and depression. So try to control yourself. Try to control your family members. Try to control your society, and be patient. Be patient and be patient. One good news for our country, that our honorable Prime Minister, Her Excellency, he has already passed a order to the concerned people to have minimum 2 samples from each and every upazila every day. So, and already we have heard that there are already 17 stations throughout the country to take test. And one important thing, Korea, Japan, they have controlled COVID-19 by 3T. First, for example, 1T is for trace, second T is for test, and third T is for treatment. Trace, test, and treatment. And these 3T will recover us, inshallah. And our government, our concerned people are so alert to do this 3T, and we will recover this from these diseases, inshallah. No more today, more when we meet, and I will come in front of you with a new subject and new topic, inshallah. Assalamu alaikum.